Good evening, everyone. Come on in. I'm just going to go ahead and populate me on the main screen here. Here we are live. Good evening, everyone. Come on. Don't mind me, I'm eating my brownie. I got home from work late. Excuse me. Hi, Candy Doll. Gary's Passion's in the house. We're good. I'm good. Hi, Candy Doll. Gary's Passion's in the house. Brown Eye Truckers here. We're good. I'm good. How y'all doing this evening? So tonight we're going to talk a little bit about the shoulder if you want to. Excuse me, as well as we're going to, if you guys want to connect a little bit, we'll see how many people we get here. I just ate dinner really fast. Hello, it's Jason, Queens of New York. I'm doing all right, Jason. How about yourself? Megan Mann is in the house. Candy Doll's still here. So you guys have any questions before we get started? A little bit on the shoulder at all? I got 3 or 4 in the house right now. At least it kind of tells me that there's a little bit of a delay. I lowered all the settings and quality and reduced the latency, and it still is a little bit of lag. Oh, she asked. I got Brown Eyed asked a question. What am I looking at? Hi, hey, Joe. Gary's Passion. Hello there. She said she asked her question yesterday. No, Brown Eyed, I didn't see it. Oh, shoot, it's on the post from yesterday. All right, let me wait 1 second. Let me see if I can find it. I'm looking for it, Brown. I'm still looking. Man, I saw a lot of stuff here yesterday. Okay. I'm still trying to find it here. Scrolling through here. Can't find it. See everybody and their brother but you. No, I can't find it. Sorry, I'll have to look later. Oh, got 7 or 8 in the house. Hi, Susanna. Hi. I got 8, 9 in the house. Beautiful. All right, thank you all for coming. We'll see who else comes. So get connected. Be nice to one another. We're all going through a rough time. Hopefully people are doing okay. Hopefully they're staying safe, staying healthy through this crazy madness we call the corona or the COVID-19 virus. We're going to talk about the shoulder a little bit. People have some generalized shoulder pain a lot. There's a lot of different topics that I can talk about specifically just on the shoulder. Different types of shoulder pain that you can have. Different types of surgeries that you can have in regards to the shoulder. So maybe tonight I'll just talk about a few of them. If you guys have any questions, we'll go ahead and try and answer them at the same time. So we have these 3 bones that basically make up your shoulder. You have your collarbone, your shoulder blade, and your humerus or your arm, which everybody thinks is your shoulder, but it's actually these 3 bones together. And so as your hand comes over your head, this ball actually drops downwards. Your collarbone actually rotates outwards like a strut on a car, and your shoulder blade actually rotates as your hand comes over your head. And so I always tell people it's like a seesaw. As your hand comes over your head, the ball has to drop down, kind of like a teeter-totter seesaw thing that used to play with as kids that you don't see anymore because apparently it hurt all these kids, so they stopped putting it in the parks. But as when I was a kid, you could play on those things. So we have these 4 muscles that essentially make up the rotator cuff. All right, that's C-U-F-F, cuff. It rotates your shoulder out, rotates your shoulder in, and it helps to initiate the movement of over your head before these other muscles kind of engage and help out. They're very small. You got one on the inside, one on the top. This one on the top classically gets torn the most because it has to go through this entire canal that you can see. So that basically the metal piece represents the muscle, and it has to come through and connect on that side. So it's very easy to get damaged over time. So, and then you have one here on the other side here called the teres minor that runs from the inside of your armpit to the shoulder. And so those four muscles basically make up the rotator cuff. There's one muscle called the long head of the bicep. Bicep meaning two in Latin. One runs all the way up and attaches into the labrum at the top here. That labrum is essentially what makes the cup part of so the ball has something to sit into. And so that bicep attaches to that labrum. People used to call it the fifth rotator cuff. It does play a lot and role, but there's always been a debate, on whether that is truly a key component of the rotator cuff mechanics or not. Hi, Panoya. So we got 7 in the house. You might see some people coming in and out. Some people are driving, they're still at work, and they're nice enough to at least watch me for a little bit, which I think is really cool. So when I talked about the main rotator cuff muscle that gets torn or gets inflamed or irritated sits on the top here. It's got another muscle called your upper trapezium or your shrug muscle that is over the top of this muscle. And this muscle in here, this main rotator cuff muscle that gets irritated or torn, refers symptoms down the side of your arm and kind of feel like if it gets bad enough, excuse me, I ate really fast, it might feel like it's in the elbow. And so that's actually your rotator cuff, which is in this main one is your supraspinatus. That's giving you that referral pain down the side. And it can get the levator scapula muscle that I've talked about in a playlist a while back, and that attaches to what we call the transverse processes on the neck here. And so it kind of sits kind of like this. So you'd have your ribs obviously coming out. The shoulder is it's what we call a floating joint. It's really only attached to the spine by the sternum. And that's about it. The rest of this just kind of hangs on. And so when there's any tear in a tendon, or you got a bunch of muscles that are inflamed or irritated, it really starts to mess up the mechanics of these 3 joints to allow your hand to come over your head. Hi, Nina. And so at any time you can get that weird referral pain, and like I said, you can get a lot of these muscles that attach from the shoulder blade to the neck can also get inflamed too, and next thing you know, you got a lot of referral pain from those muscles going down your arm, going down the middle part of your back. It could be wrapping around the front to the chest area. So those things are really bad active trigger points, what we call them, or latent trigger points. I've talked about this in the past too, what's the difference between active and latent trigger points. So the active trigger points, or what we call kind of centrally mediated trigger points, they can refer symptoms all over the place. And you have these latent trigger points or satellite trigger points that kind of are kind of attachment to those central or active trigger points. And you have like tenderness, but it doesn't really go anywhere. That's kind of a latent trigger point, versus if you touch it and it starts shooting pain somewhere else, that's an active trigger point. So they're kind of the basics of the two. We got a shout out from Nina UK Vlog. United Kingdom coming in the house. Candy Doll wants the queen. So when we talk about the shoulder, and the shoulder blade itself, a lot of these muscles that kind of sit on the inside of your shoulder, I'm going to bring little mini-me here. So if you look at it this way, a lot of those shoulder blade muscles also attach to the spine. And so if you kind of sit a lot forwards, or if you have a tilt to your shoulder, it's overstretching or over elongating those muscles all the time, and that can get those trigger points really flared up, and you might have that causing a lot of your pain and might have little to do with the rotator cuff. But they kind of play on one another, the rotator cuff and those trigger points. They kind of like, if one gets irritated, it starts to irritate the other one, kind of like if you have kids. Your one son or daughter starts irritating the other one, and then you got them both irritating you. So that's kind of like how I look at it. Jonah Channel, hi Jonah. I got people coming and going pretty quick here. There was 8 or 9 in the house not too long ago. I don't know if they're going out to watch other people's videos or they're just popping in and out, which I do thank them for that because they didn't have to. If you guys have excuse me, any questions in regards to the shoulder or the rotator cuff or maybe some neck problems, I can go ahead and answer those. So I'm going to leave this for a second, see if you guys have any questions. Thank you, Jonah Channel, for giving me a thumbs up. Some people, when they have just irritated their shoulder or whatever, they wake up one day and it gets irritated. They do some stuff at work or whatever, at school or whatever, and it irritates it more, and then they go back to sleep and do the same thing over and over again. So the reality is you want to stay away from sleeping on that side as much as possible, because it does put a lot of pressure on that rotator cuff, that main muscle, as well as it starts to stretch out that muscle. So let's see if I can find, we'll do tissue muscles, I'll call it. So we're going to take a piece of tissue paper here, kind of wad it up for a second. And this represents the muscle. So we're going to show how it travels. And so it kind of attaches here on the front. And so if you're sleeping and you tend to sleep, that's going to put a lot of stretch on that muscle as well as load it a lot, and that can cause a lot of the pain, or what we call anoxia, to that tendon. There's not a lot of blood flow in it anyways, especially the older you get, the less blood flow that happens in that area, which hence it causes it to get injured much easier, because the less blood flow in the area, the more likely it is to get damaged, or the less likely it is to recover fast enough before you damage it further. And so that's the big one, is making sure you stay away from sleeping on your side. What I tell people to do is take magic towel, put it underneath your armpit, and so you have a tendency when you sleep, you can't sleep on that side, so you'll roll to the other side. So you can always use magic towel, roll the towel up, put some tape around it to maintain its shape, and you can always do that. I got a question here from Queens, New York, as they say up there, and they're wondering about their knee pain. Nothing worse. What do you suggest for knee pain when everything doesn't work? Well, everything is an awful broad stroke of paintbrush. So you'd have to really find out, and that's the one model I haven't bought yet, is a knee model. So you kind of got me there. But if I could show you on a knee model, or in this case on an actual knee, it could be arthritis, okay, depending on your age, causing some of the pain. That would be just kind of joint line pain that comes and goes. The more you do, it kind of reduces for a while. If you sit down and let everything get cold and you get up, and that causes some pain. It could be a tendon problem or a bursitis around the area. You could have a ligament that's torn. You could have a kneecap that's tilted, what we call patellofemoral syndrome. So there's a lot of different things that could cause your knee pain. I do have a couple videos on the knee. I definitely need to do some more videos on the knee. There's a bunch of different things that we could discuss, and so that's probably down the pipe a little bit in regards to when I'll come out with one of those videos. So, if you could give me a little more detail, Queens of New York, maybe I could help you out. But so I'll leave that up to you, whether you want to give out some more information that might be able to help me figure out at least an idea where you might want to go. Have you tried injections? Have you been to an orthopedic doctor or a physical therapist in your area? All right, maybe you'll get back to us a little more. But, so, if we come back to the shoulder, and like I said, you know, you can, this thing is just kind of floating on there, literally just kind of floating with just the sternum in the front, kind of holding it all in place. And so, this little joint right here on the end called your AC joint, or A, which is this little bone here on the end of it is called the acromion. This is called your spine of your scapula, this little ridge here, but at the end is called the acromion. And then you have your collarbone, or in this case it's called your clavicle. So you have the A, acromion, C joint, so AC, clavicle. Sometimes, you know, if you're young like my nephew was and he had an AC separation, and there's different grades to that depending on how bad the ligament has been pulled apart from each other, the two bones. You could fracture your clavicle. So that's not good because this clavicle has to rotate as you bring your hand over your head, like I said earlier. And so if you sprain or injure that clavicle, you're probably going to be in a sling for a while until this thing heals up. All right, I got girlfriend has tried pain relievers, hot and cold compresses, keeping it in an elevator, but it hurts when she stands on it for too long of a time, or too long, you know, a too long period of a time, or something like that. So, yeah. So this is your girlfriend. I mean, there's so many things. Until you see someone or give a better description, which I know it's hard, but when it comes to a knee, just generalized knee pain, it could be anything. You could have, I mean, there's so many. I call it the runny nose syndrome. A lot of things can cause a runny nose. What I would tell you to do is at least maybe pick through my knee playlist and see if you could find what I've described there that might help you a little bit better. Some range of motion exercises, some basic hip and knee strengthening exercises. I did one probably like 5 or 6 videos ago. Talked about kneeling, how to protect your knee. So that was a video I did. You can look at that to see if when she does some stairs or when she goes to stand and sit, if she's pulling her knee in a lot, or what we call genu valgum, or knock knee for layman's terms, that might be causing a lot of the pain. That's just a basic mechanical issue. I mean, if it's not that, it could be 100 different things. It could be chondromalacia patella, patellofemoral, tendonitis, bursitis. Could be arthritis. If she's got rheumatoid, it could be rheumatoid arthritis. You know, it could be psoriatic arthritis. You know, it could be just a ton of different things it could be. I'm sorry I couldn't give you a better answer. It's just so hard unless you say something like, oh yeah, she fell, and the doctor says she has X, Y, and Z, or something like that, or, you know, some sort of mechanical reason. But if it's just generalized knee pain that's been going on for a long time, it's a tough one. If someone's morbidly obese, for every 1 pound you're overweight is 4 pounds of pressure on your knees. So let's say if you weigh 80 to 100 pounds more than you should, you times that by 4, you're talking 320 to 400 pounds of pressure. So that's a lot of stress on the cartilage and the mechanics of the knee. And as people exercise, you know, it does the range of motion and the different types of mechanisms that help keep the joint lubricated. That helps, and strengthening, but also what helps really is just a reduction of some weight. So those kind of factors play in. I would say find a physical therapist that sounds something like I'm saying, and give you a good idea. And then maybe come back and ask them for some more questions, something along those lines. Maybe I could help you further. Got Candy Dell TV saying Queen's going to your home now. So it looks like you guys are going to lock and connect, or I call it lock and loaded sometimes. I tell people to try and see if I could get them to laugh. Do you guys have any questions about the shoulder? All right. This technically is called the shoulder girdle complex. That means it's all three of these bones together that we're talking about. If you don't, we'll talk about one of the basic surgeries I see a lot. And I'll tell you why we see it a lot. So let's just say you tore that supraspinatus, which is this muscle that I'm pretending that this paper towel represents. Sits in that little spot here called the fossa. And so let's say you tore it, and you're usually tearing it from the tendon junction. All right, it depends on what grade it is. You could have a partial tear. You could have a crescent-shaped tear. They can describe the tear in different manners. You don't want to retract the tear. That means that it's torn right off the bone, and you're dealing with a tendon that's just kind of the muscle that's just pulled up, and the tendons pull off the bone. That's not good. That's not good at all. But the one main thing you'll see if you have to have surgery, and it's just this main muscle group, what they'll do is they will shave underneath this bone called the acromion. They'll shave that, called a subacromial decompression, or essentially they just shave underneath there. And what that does is allow some extra space for this muscle, so when you raise your arm up, it doesn't pinch against that bone. They will go ahead and shave this part of the clavicle, and so that gives the tendon some room as it goes through this little canal or shaft. They might cut this top ligament. All right, this is called the coracoid acromial ligament, and it's really just because this bone in the front, which is all part of the shoulder blade, is called the coracoid bone. Part of your bicep attaches to that, as well as your pectoralis minor attaches to that. So that's a huge little bony thing there. It's pretty big. And so they'll cut that ligament, and so that allows a lot of room for this tendon. So when it gets repaired, it's less likely to get injured or get impinged. And how does it get impinged? Well, when the mechanics of your shoulder blade are all off, what happens is the head of your humerus, this bone right here, kind of jams against the roof of this acromion, so that you see how that paper towel can get pinched between those two, and that can cause an impingement. And we have those different tests to find out whether it's pinching in the front, pinching in the back, or pinching in the front, or pinching at the top. So there's a couple different movements that we put your arm in to see where exactly it's pinching at. Queen says, thank you, Candy Dell. Welcome to the family and be safe. Well, there we go. I made a, what do they call that? A subscriber. Can't type it. Please don't type it, but I can at least say it. Kind of silly. Anyways, so they will go ahead and shave underneath this acromion. They'll shave off the piece of the clavicle. They'll cut this ligament here, and they'll sew this tendon. They might have to sew it, and might have to do it on a little, what they call a portal or a punch hole into the bone here to really seat that tendon, what part that's torn, back on there and secure it good so that it doesn't happen again. If you have to have your rotator cuff, whether it's one muscle or the other three muscles that I talked about fixed, you're expected to at least be in a sling for at least 6 weeks. You're not going to be moving that arm. The therapist will passively move it, and they'll be doing that for probably 4 to 6 weeks, depending on your particular surgeon's protocol, but that's kind of the gist of it. You got to give this thing a good 4 to 6 weeks to really heal up, so that, God forbid, and you're not supposed to actively move it, because then you could pop and mess up the entire surgery. Next thing you know, you have the tendon that popped off the bone, and next thing you know, you have no tendon attached, and you're doing this, and you're wondering why you don't have a nice smooth motion. Just because you screwed it up. I would like to say that North Carolina pollen is terrible here still. All right, so that's the basic surgery that they do to repair that rotator cuff, the supraspinatus tendon, and why they shave and cut back the different structures of the bone. It's really to protect that. And then you'll go to therapy. We'll work on passive motion, probably work on reducing the pain in the shoulder blade, probably work on your posture and so that your shoulder blade's tilted back, it's not really tilted forwards. And we'll kind of progress you through an exercise program to get you as best as we can back to where you were prior to damaging the tendon in the first place. Sometimes you get two of them, so you could have the muscle on the bottom. It sits literally on this flat surface, and this is called your infraspinatus, and it kind of attaches to the side here, and also helps with rotation out. And that can get torn, as well as the supraspinatus, the one on the top. Supra, infra, above and below, pretty simple. And they both can get torn. Now you're dealing with some real serious problems. Now you're dealing with probably a lot more surgery. You have to have another tendon repaired, so your recovery time is going to be that much longer usually. It all depends on other factors like diabetes, any type of vascular issue, if you're a smoker, all these things that affect healing. If you rheumatoid arthritis, any other type of maybe a genetic disorder, something like that, that can affect this healing to heal up quick. So you can always look into that. Typical surgery, to get someone back to where they think they should get back to, is probably anywhere between 4 to 6 months. Now they probably won't be in therapy that long, but it'll probably take that long to recover. But when you're starting to deal with 2, 3, and all 4 rotator cuff muscles affected, you're dealing with months and months and months of rehab. It's a long recovery time because these muscles are very small. People end up adapting really quick of shrugging and not moving correctly, and that makes other muscle groups strengthen in the wrong position. I got a shout out to Batman, Shiraboom 87. Thanks for coming. I think this might be your first time coming to my live stream. At least I think so. I don't write them down, but I have a fairly decent memory when it comes to pictures. Names, can't pronounce names. Lucky I remember my own name. That's why it's 3 letters. Brown Eye Trucker says she's here. Beautiful. I got 9 thumbs up. Hopefully I can get some more. Some of these people are getting like 30, 40, 50 thumbs up, like, what's his name? Gekike or whatever his name is. Good Lord. One time he did a live stream and he was sitting on his toilet. I'm like, seriously? People were just sitting there and then I got another really good friend of mine, Gore McTar. The last week and a half, all he's got is a shelf facing the camera. He's not even there, and there's like 14 and 15 people. I'm like, I can't figure this out. The last thing I'd want to do is stare at a blank, so they call it a silent live stream or whatever you want to call it. I don't know. I guess if you had a lot of people, you could, at least, maybe get a subscriber or two. I don't know, I'm having a tough time on Wednesdays. Wednesdays might not be the best day for me. I don't know. I've done this at least 4 or 5 weeks in a row with Wednesdays live streams, and I'm floating around like I think I've had 10 or 12 at the most. Not quite certain. I think I might be fighting with a lot of other live streams. I got the Bullock OFW. So, that's the basics of the shoulder. That's how that's the bones of it without getting too crazy detailed. That's the basic muscles of the rotator cuff, how the clavicle, excuse me, the shoulder blade and the humerus actually move, or the scapula. If you have a stroke, I have a wonderful occupational therapist. He does all the strokes, but a lot of times you can have what they call a piano key or a step off, and that's where, since the muscles have lost their tone, their normal tone because of the stroke, it just kind of droops down and the weight of your arm starts to really pull, and next thing you know, you can have what we call a piano key or a step off, where there's a huge step off between the end of the collarbone and that acromion bone, and also a step off between the acromion and that humerus, and so that's pretty dangerous. And obviously you'd worry about dislocations and pulling on those rotator cuff muscles, because they're running from the shoulder blade over to the ball. So you can have that piano key sign, they call it, coming from the end of the acromion to the head of the humerus, and so they'll end up, doing all kinds of, whether it's taping or exercises or slings and stuff like that, to reduce the stress on the ligaments and the tendons. But that's kind of scary when that happens. Oh, Brown Eye Trucker tells me, I have pain in the front of my shoulder. It comes and goes. I tried heat, Epsom salts, and a shot. Well, that shot helped temporarily, but it's probably from shifting gears. Yes, if it's your right arm and you're over a lot like that, Miss Brown Eye, yes, what you need to do, obviously, since you can't stop driving that beautiful clean green truck that you have, and the shout out, you guys should be watching her. She's really good. Like all of us, she's getting her content better and better, and I think she's really entertaining, and you get to see another lifestyle besides your own. But what I would do, if you can, you might even have to get a much larger towel roll, so it's nice and thick, so that the middle part of your back, okay, so it's up nice and tall, so that you're not tilted forwards, causing that, because it's what I talked about, Miss Trucker. You're probably impinging your supraspinatus tendon. And what I mean by that is that main tendon is coming through that sleeve, and as you raise your arm up, you're literally pinching that tendon against the head of the humerus is the floor and the acromion is the top. So if you tilt your shoulder blade back, it opens up the space like where I'm at versus like this, and trying to do that. So if you're up taller with maybe a bigger roll, so it doesn't feel like you're so far away from that, and you got that nice back and shoulder blade support coming from the towel roll, you might do better with that. Yeah, because the steroid or the Depakote shot that they do, that's just to decrease the inflammation. If that helped a lot, obviously a lot of your pain is inflammatory based. You can always take a pillow or whatever, if you can, and maybe, or a box or whatever you have, whatever you can do. I know you're driving, to maybe unload your shoulder while you are driving, or at least fill in the space if you can between yourself and that shifter knob. The best thing you can do is actually ice the thing at night, stay off of it. I have a bunch of playlists for my shoulder. I've gone to a ton of shoulder courses over the years, and so I'm pretty good at shoulders. And so if you look at some of my taping techniques, you could try those. But I think right off the bat, the towel roll would probably work the best, with a nice thick towel with tape around it, and so you can put it back there or bridge the gap between the two spots. You could get the Theracane and buy one of those that I've put in a bunch of links in my videos under the comments part. I leave a link that says Theracane. That's that purple blue thing I have, and you can work on the knots in your neck and shoulder blade area to free up, so maybe that will free up your shoulder too at the same time. So those are all different things that you can do on the road. You don't need to be anywhere. Looks like I got 3 in the house right now if you count myself. I'm going to get some more to drink. I'll be right back. All right, I'm back. Do you guys have any questions? I mean, so the biggest thing when I get my rotator cuff irritated, because the reality is over time, the like I said, the rotator cuff. Don't mind my cookie. I got home late from work, had a busy day. There's 3 things that happen as we age, as we get older. One, you can start to get what's called a hook on the end of this acromion bone here. Literally, it's a hook, and so there's 3 or 4 grades to it. So the 2, the 3, and the 4, you know, at that point it's hooked right over, and as you can see, it's right where that muscle would come through, that supraspinatus would come through. I should have probably just left that tissue in here. And so that what we call a hook of the acromion, and you can usually see that in an x-ray, but you can also in the clinic you can figure it out pretty quick if that's causing someone's pain or not. But that hook would come right on over, and if that person raises up their arm, it just digs into that sucker. They have immediate pain. And so what happens over time is our body builds either calcium deposit or osteophytes or spurs, whatever you want to call them. They all mean the same thing. Basically, the body is responding to stress. No different if you have calluses on your hands or your feet, it's responding to stress. And so in this case, you probably did a lot of stressful stuff with your shoulder through the years, and your body ended up starting to build a calcium deposit. In this case, it turns into a hook on the end of this bone. That's one issue that can happen with people. So what they call the morphology of your bone actually changes as we age. The other big thing that can happen, like I said before, is that the blood flow of that tendon reduces as we age. It's much easier. It gets frayed much easier. That's why you can start having pain down the side when you sleep at night, and years ago you never did. The other big thing is these particular muscles along the back side of your shoulder here that attach to the top of the shoulder and run to your neck. Since we do a lot of forward work all day long, they tend to get over elongated and get active trigger points. And then that starts to mess up the mechanics as you bring your arm over your head. You sleep wrong one night or you sleep kinked. The next thing you know, that kind of starts a forest fire of problems for this entire shoulder girdle complex. So for you two, it's reducing the active trigger points first with Theracane, using ice to reduce any referral pain down the side of your arm coming from that rotator cuff, magic towel to put your shoulder blade from a tilted position to a what we call a retracted and downward or posterior tilt position, so that it puts all these muscles in your neck and shoulder area on a shortened rested position. It's kind of the same idea with the taping techniques that I've gone over on my playlist for the neck and shoulder. You're basically pulling all that tissue in a shortened position and putting a piece of tape there to keep that area in a shortened position for long periods. But amazingly enough, in a few days, if you try doing the towel roll and keeping that shoulder back and down from the towel roll, don't try and do this all day long. You won't be able to maintain it. It's just absurd. But if you use a towel roll and you can kind of hang on it, hang on your spine a little bit as you're driving down the road, and kind of just really work on that and get that Theracane that I've put on before that really work on those knots in your shoulder blade area. That will help your symptoms. Icing is the other big thing. If you have any referral symptoms down your arm into your elbow coming from that shoulder, ice it. Don't be heating it. The other thing that I forgot to tell you about, but now that it hits me in the forefront, your labrum, which is basically the thick tissue that I talked about earlier that the ball can sit into. Without the labrum, basically your shoulder, your socket is a flat surface because it's the end of the shoulder blade. Because your shoulder blade is a giant, weird, irregular shaped bone, really is. And so that labrum needs to come on out, and so that ball fits right in it. And as we age, that starts to fray, and you can naturally have tears in your labrum that are asymptomatic, which means you don't have any symptoms coming directly from that until maybe you do something like, pulling on something like a window that's stuck, or pulling like this, or pulling up on that, and that bicep that attaches into that labrum pulls hard and then really gets that whole thing inflamed. Sometimes you can get lucky with a shot in that area and it calms everything down, and then you go to therapy and you're good to go. But if you end up tearing that thing more, unfortunately, you're probably going to have surgery. And what they call that a slap tear. Superior labral anterior posterior. I did a whole video on that, I think, a couple weeks ago. SLAP. If you tear the bottom part of your labrum, it's called a Bankart. And so basically what they do there is they make little holes in your labrum, and they basically pull the labrum back together and sew it up. So that's what they have to do with that. If they get lucky on the top with a slap tear, and all they do is trim that off, they will cut the bicep long head off. Okay. Sometimes if you're young enough, they'll attach it. What I talk about, they attach it to the long head of or what we call the bicipital groove, where the long head of the bicep travels into. They'll cut that off the labrum, and they'll attach it to the front here, called the biceps tenodesis. If you're an older person, they won't. They will just cut that thing and let it retract down. You got plenty of other muscles. You have the other head of the bicep that can do a lot of motion. You don't realize the bicep does this, but its main function of the bicep is actually rotating up. And so opening the hand and pulling. But the main function of the bicep is opening the hand up, or what we call supinating. So people don't realize that. They all think it's because of, curling. No, that's not the case at all. People always wonder why the bicep's smaller than the triceps. That's because there's 3 muscles of the triceps, hence the word tri meaning 3, bi meaning 2. So I got 3 in the house. I think people fell asleep and left. I bored them to death. So that's the so that's the basic surgery. There's plenty of other surgeries they can do on the shoulder. Essentially, you have the chronic patients. You have the patients that either have a labral tear of some sort. You have patients that have either a rotator cuff tear or a strain. Okay, so the difference between a strain and a sprain, you strain a tendon, you sprain a ligament. So usually one ends up happening. So let's just say like you fell and you sprained your ankle. Where's my ankle? Okay. Say you fell and you sprained your ankle, and usually it's the anterior talofibular ligament or the calcaneofibular ligament. It's basically the ligament that runs from your heel to the outside bone, your fibula, or from this way and so basically what we call an inversion sprain where you turn your foot in. So when we look at that, we say we had failure of a couple different things. We had the failure of the muscles to hold the foot in place. Then we had the failure of the tendons to hold everything in place. Then you had the failure of the ligament to hold everything in place, and then it starts to go. If you get a fracture, that means even the ligament failed, and obviously then all the forces went through the bone. So you kind of think of it that way as something happens, whether it's a sprain or strain, because a lot of times doctors will just put sprain strain, and I'm like, what the heck's that? That's not a diagnosis at all. That's just basically someone throwing stuff at the wall and see what sticks. Hi, Azuma. Thanks for coming. I appreciate it. If you guys have any questions, I'm talking about the shoulder. I talked to Queens for a little bit about their knee or their girlfriend's knee. The main point was to get people connected, but I also like to talk about at least a body part or any questions that you have, and I usually just zone it down to, in this case, I did the shoulder tonight. But you guys could ask another question if you want. I always leave the forum open a bit. I don't want to just, want you to think if you don't have, if it isn't about the shoulder, you can't ask the question. I think my weekend Saturday / Sunday show with Scully is going to be probably on different types of stuff with COVID-19 and physical therapy and anxiety and stuff like that. So stay tuned for that. That's going to be my first kind of see how I do in regards to not just doing home treatments. We'll test out that video and see how it works out for me. So that'll be coming. I probably won't get it into the system and probably until Saturday afternoon, because I think this one's going to take me a little bit longer. Oh, cinnamon twist at Taco Bell. I know the cinnamon twist I get at Pizza Hut are really good, but I've never had them at Taco Bell. Sakiri is asking Brown Eye Trucker to connect, I think, or maybe they already are friends and subscribers. Hard to tell. I think I got 4 or 5 in the house right now. Wednesday evening coming to you live. Hey Trucker, where are you at? Are you doing long hauls or do you do short runs, Brown Eye? I miss Susanna there. I hope she's still here. Hi, Susanna. Do you guys have any questions in regards to the shoulder at all? Sharaboom87, you're welcome. Hopefully I can help you out a bit. Like I said, my playlist on the shoulder is going to go in a little bit more detail than what I'm talking about, but it's generally the same kind of stuff. I think, even if you want to do a TENS unit, but a TENS unit, there's not a lot of carryover in reduction to the shoulder pain, unless it's like you had a shoulder replacement. Oh, that's one thing we could talk about that I forgot about. Oh, good night, Susanna. Thanks for coming. So let's talk about shoulder replacements for a second, and reverse shoulder replacements. And they've come along very well over the years. So a total shoulder replacement is exactly what it sounds, where they literally have to replace the head and they put a plate inside the socket, so you have a new socket and a new ball. And they do that a lot for fractures or really bad arthritic shoulders, where it's like crunch, 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 or they had a huge trauma and there's no real repair besides doing the replacement. Now, hi, Rosalie Green Vlogs. Thanks for coming. Reverse shoulder replacements have come along, but obviously with that, what they do is they replace the ball in the socket, but they also switch where they are. They put the ball where the socket is, and they put the socket where the ball is. So they really do change the mechanics of your shoulder, whether it's, why they deem it needing that particular type of replacement or not. But doing that, you will not have full shoulder motion. You might get to be maybe 120 or 140 degrees of motion at best. And years ago, when we first started seeing shoulder replacements, when I first started to get out of school in the late 90s, that to have a shoulder replacement really was not functional. It was just to manage pain. So you had a lot of pain in the shoulder. They replaced the shoulder, at least you didn't have any pain, but you had no function with it. Since I've been a therapist for 20 years now, they've changed it. Now the paradigm is completely different. The better surgical techniques, better hardware, and now they've made those total shoulder replacements functional. And it's amazing because for me, I've seen that a complete paradigm change. And I don't laugh, but I laugh inside my head at some of the patients where they expect they replace the shoulder and they should have their full motion back. And I keep telling them, like, hey, when I first started as a therapist, you didn't get any motion at all. That was just there to manage your pain. So just like I talk about with the hip and knee replacements, people have a way crazy perception or expectation early on after surgery. It's no different with a shoulder than it is with a hip or knee or any other shoulder. Though I notice with backs, lower back surgeries and neck surgeries and stuff, people's perception is a lot less. I don't know what it is about the other joints, what we call the extremities, the hips, the knees, and the shoulders, that I see a lot. But when it comes to the spine and people have surgery on them, they don't have the same expectations and where they think they are versus where they should be. Excuse me. So that's interesting, that I sit and ponder on it a second. If you guys want to go ahead and connect, go ahead. Too bad they all wouldn't stay at the same time. I've had, all together probably, I don't know, 15 or 16 or something like that. So, it's a shame that they didn't all stay. That way they could all connect at one time. But Oh well, everybody's got a life and people got things they gotta do, so I'm just appreciative that you all stopped by for at least a little bit to hear me gab. Even though people don't like my voice, I say it's better to at least to hear a voice and see something that's silent video or silent whatever they want to call it. You know, I don't get that. I mean, I'm really surprised YouTube hasn't nailed down on that. Maybe they haven't, or they will, or they just can't yet because of all this other. They don't have any people on there. But I really bet they crack down on that. You people getting video time, and they're not interacting at all with their audience. They're just whatever's there, whether it's a shelf or a plant or the sky, or I've seen 100 different ones, and they're if the thing's on for 8 or 12 hours and people come in and out and they're getting, shoot, you could probably get 50 or 100 hours of watch time if you're lucky enough and you haven't done anything. Oh, you're cooking dinner. What are you making for dinner? I had a since I got home late from work, so I was busy. I had ham and cheese, lettuce, some potato chips, and a soda. It's terrible dinner, but oh well. Sometimes you do that. I do it for you all. I had a really good lunch, and I'm sure I'll have a really good lunch tomorrow because my wife made something nice. I got 2 or 3 in the house right now. People are falling out like flies. I did share this out with my post and did share it out at Facebook. We'll see what happens. It's hilarious. I have like, I don't know, almost 1,300 subscribers and I have 15 people show up. That goes to show you how good the subscriber number really means. It don't mean much if people don't come and see your stuff. I've seen, who did I was checking out because I was being nosy. I really like him. He's Familier or something like that. He's Spanish, or he speaks Spanish, or I don't know, but he's a really nice guy. But he's got like, I don't know, 30,000 or 34,000 subscribers. And if you look at his videos, the poor guy has like I mean, we're going back weeks and weeks and weeks. The guy has like 1,000 views, 800 views. Really? You have 30,000 subscribers and you have 1,000 views or 800 views on your videos? Man, I would be dropping those subscribers like it's hot. That's ridiculous. There's no way that you should have that many subscribers and so little views on your content. I'm like, holy, I couldn't believe it. I had to go back and look at it twice, and I kept looking down, and yeah, the view count gets worse the older the video is. Right now, I notice my videos, I get probably about 25 to 30% of the video being watched. I've looked at my analytics the other day. They're watching it a little bit more with the B-roll. The antics of Scully and myself, as well as Dr. Cool Cats and Dr. Know-It-All. I have seen people. My watch time is longer, and so it's not my content. So my content's good. That hasn't changed. What's changed is how I present the content, and so for me, that's what's driving me, and so that's what I've noticed so far with my analytics. I laugh when I type in YouTube and it says, what's the average watch time? And they say like 60%. I want to know out there, do you guys know anybody out there that's getting 60% of their video watched? I'd love to know. I mean, yeah, if it's a 30-second or a 2 or 3 minute video, maybe you're getting 60%. My intro video that's 40 seconds long, of course people are watching that. But like a typical run-of-the-mill 5 to 10 minute video, I would love to know who's getting 60% watch time. Did you just fart? No, I didn't just fart. It was probably my chair. I think I have 2 or 3 in the house. Everybody left me. Miss Roselle Green vlog. And probably Miss Brown Eye Trucker. She's probably, I don't know what she's doing. She said she was at work or driving, so she was listening to me. What's very sweet of her. She's so nice. Usually X-Ray Girl's here, but she's probably busy tonight. We're down to 2. Then there was just 2. So that sounds about right. I get about an hour or so into it. People start dropping off, which I understand. No one had any questions in regards to the shoulder. If there anything else that you guys would like me to talk about, that was kind of like what I brought in the forefront, was the basic types of treatment for the chronic shoulder or shoulder pain, where it could be coming from, the basic shoulder surgery, what they do, how the mechanics of the shoulder really works, what really makes up the shoulder itself. I thought it was you farting. No, good Lord. No, it was not. It was, you know, if you smelt it, you dealt it. All right. So that is the shoulder itself. No one has any more questions. And it seems like everybody's dying out. I can smell it. Wow, laugh out loud. Just kidding. I'd say if you can, we need to patent that technology immediately. And we're going to be billionaires, girl. You know how much money we can make if you could start to have aromas through video camera? Oh, my Lord. It could be crazy. All right, I think I'm gonna sign off because I don't see anybody else coming in, and I don't see any other questions. And I basically talked about the shoulder for about, I don't know, 70 or 80 minutes. That's pretty good talking about one body part for that long. So, hope you all are being safe. Keep up the good work out there, creators. Scully and I always say we like to have you look up and keep smiling. And look for my next video, probably sometime maybe Saturday afternoon or Saturday evening, depending on how much of the video I can get done on Thursday, Friday, and Saturday. It's hard to tell, just like my life is busy, and I'm sure yours is too. So kind of look out for that, and I'll be looking out for your guys' videos also. All right, so keep up the good work, and I'll see you next time.